Wait, tell me, are you starting?
Yeah.
Oh.
Welcome to HealthCast305, Miami's source for all things health related. Today we have Sarah Glick, Dr. Sarah Glick. She's also a physical therapist. I graduated school with her as well. So, 2 days in a row, 2 episodes in a row, I'm working with former classmates because UM is so good. Such a great PT school. And she's going to give us a ton of information regarding common running faults in runners and how you can fix them. Okay, so I'm going to start off with a little introduction of Sarah. Could you tell us a little bit about your background? I kind of left it like you didn't know I was asking the question.
No, that's fine. Well, in terms of physical therapy, like Rob said, I graduated from University of Miami in 2017. I've been working with University of Miami since, and I did their sports residency as well. That's my background in terms of my physical therapy right now.
For now, yeah. You didn't mention the part about your historic running abilities, because people tend to care more about how well you do and the things that you teach, sadly. So do you have any good history in running? Like any achievements you can mention?
I mean, I like to run. I've always been into running. I used to race a lot, and then I had some health things and recovered, and I was able to get back into it, and I was able to kind of train again last year. And I really, really love running half marathons.
Yeah.
Is that good?
The half, yeah, I guess we'll go with it. Yeah, because the half marathon is more intriguing than the full, right?
I mean, I like both. Like, if it were up to me, I would love to just run all day like Forrest Gump. However, with half marathons, you can really just like race it. So I don't know. I like triathlons too because you get a little bit of everything. However, the half marathon is my favorite.
Yeah. I heard of the half marathon. It's the extra 13 miles at the end that make it hard. So.
And you get to place in your weight class.
Yes, my weight class being at 200 plus. I do well in marathons. I just have to ride a bicycle, and I tend to do well. That's
They
usually
do have
where.
a Clydesdale group.
I like how they name them after a horse.
There's Clydesdale and Athena for those of us that are a little bit more muscly.
A little chunky.
Can
I wear roller skates? That's my only hope.
Nope. Negative,
Okay.
Ghost Rider.
Yeah. Well, maybe I'll just buy a Clydesdale and do it then. All right. So, today, yeah, it's about bringing a horse, right? So today we're going to talk about running faults, like we mentioned. Okay, we got off track, and so I want you, Sarah. I'm demanding that you tell me roughly 7 different running faults, but no more and no less. And I want you to describe to me, what they are and how people typically go about fixing them. Because we got a lot of active, healthy people in Miami listening right now. They want to know how to fix their running faults. And they're out there running, they're getting hip injuries, their knees are hurting, they're breaking down. I see them on the road. Mm-hmm. I give them CPR daily, and I need to know how to help these people. And this is your specialty, because Sarah's amazing with runners, and that's like, she has a lot of specialties, and she took a sports residency, so she's extremely smart on top of PT school. So she has a lot of experience with like professionals doing this. So I'm going to leave it up to her here, ask her some questions along the way. But so let me hear a little bit about some common running gait faults.
Yeah. So, well, I want to start off by saying that, running obviously is such a dynamic thing, and everybody, if you look and you watch all the runners out here, especially right now during this pandemic, you see all kinds of forms. And some people have, what looks very efficient, and some people don't. And what's really mind-boggling is when you see somebody who doesn't have like a very efficient looking running form and they're just flying down the road. So it doesn't, unless you're having pain or you're really trying to qualify for something, you don't really want to mess with it.
Yeah.
And obviously it's kind of hard to like pinpoint 7 faults, but if you're going to, I guess you want to start with your loading rate. You'll see some people that kind of look like they're bouncing along, and what that does is you're using a lot of your energy to go up and down instead of forward. And if you think about it, you're doing a lot of hops. And so basically what that's going to do for you is put a lot of extra force in that eccentric loading. Obviously, when you run, it's kind of like a series of controlled falls if you're super efficient, because you're trying to turn that eccentric to that concentric. So you're loading to explode. If you're really loading a lot, though, you have a lot of ground to make up to actually explode after that. So that's one of the ways that you see people kind of loading tissues too much, or especially if you're going to get that like weekend warrior who's sitting at a desk all week, and then they go out and you kind of have the law of twos. A lot of people like to say, where you do too much, too soon, and too fast. And if you combine those with too much bouncing, like, you know, hopping along the way, you're probably going to wind up with pain of some sort.
Yeah, and it just kind of looks wrong sometimes, right? You see them running on the side of the road, and it's a little bit like there's a lot of up and down movement, and it's kind of apparent if you're looking from like a third person view. So that's
Yeah, you
interesting.
kind of do the oof when you see people like landing over and over.
Yeah, we're like, ooh, that's gonna hurt. That's gonna hurt.
Yeah, so I mean, that's kind of like, there's a lot to it, but that's the base. When you land, there's a whole curve of your force when you land. So you have basically like the first initial contact, and then you have the rest of the load. So the slope on that curve of the initial contact, the steeper it is, the more force, ground reactive force you're having pound right through your leg. So a lot of what you do when you're trying to control and be efficient is controlling that initial force contact and make it smoother so that you can absorb it better in order to propel yourself forward instead of up.
Yeah, and that makes sense, because you don't want to waste any energy. I mean, you're out there running 13 miles. You don't want to spend energy on up and down stuff. That's not getting us anywhere. We're not climbing. You're going forward. So
If you're going up hills, which aren't in Florida, yeah, you'd climb, but not
yeah, you could be going up like a trash heap, or the bridge.
the
That's the only
Rickenbacker.
two spots. The Rickenbacker, or you
Got it.
fell into the ocean and you're trying to climb up a little rocky entrance to the land. Who knows?
Yeah,
But
then I think you got some more problems than your vertical loading rate.
yeah, you might have some people after you. You might have to pay some people some money, and they got brick shoes on. Might be the end of it. So,
Something like
so what are some things, like the average person's listening? Oh yeah, you know what? People do say I bounce around a little bit when I run, and my knees have been hurting. I mean, there's a lot of things this could be. It's hard to pinpoint exactly what's going on with everyone listening, and that's why we always recommend to get looked at by a physical therapist if they have these issues. But let's say that somehow they know that this is their thing. They're going to a PT, they're doing stuff, and they want to add in some exercises to help. What would you suggest,
Yeah.
or activities to help them with that?
Well, I think the point that you brought up is, even if you're a
Yeah.
very experienced runner or a physical therapist yourself, you don't really know what you look like until you have somebody analyze for you. If you want to even like grab your camera and and to have somebody record you while you run, that's a huge thing. I know I myself was running one time, and my physical therapist friend was like, "Oh, did you injure your left leg?" And I was like, "Yeah, a long time ago." And so it was kind of a heartbreaking moment, because you're like,
Oh,
"Man, my running form's messed up." So, but yeah, so I guess that being said, if you're running and you hear yourself clomping along, it's most likely that you have a lot of this vertical oscillation. So there are so many different kinds of cues. You have verbal cues, visual cues. One of the first lines of defense, or whatever you want to call it, is tell yourself or your friend that you hear clomping along next to you, run softer, because that might make you a little bit more aware of how you're landing. That's not going to be the be all end all, obviously, but it's
yeah.
a start. A lot of times you have some of these running gurus who play a lot with cadence, and basically what they've deemed the best cadence is 180 steps per minute. So a lot of times what I'll do with my runners in clinic is I'll set a what's it called, the cadence,
Metronome.
thank you, the metronome, and to 180 hertz, and
Yeah.
try to keep up with it. Now, that being said, also, you don't want to just immediately jump in 180. You change it by 5 to 10 each session, 5 to 10 hertz, because you don't want to just completely throw somebody into a new style right away, because that could lead to injury as well. So play with the cadence a little bit. If you're really bounding, you're probably taking really long steps. So if you increase that cadence, you're not going to be able to take those long steps, and that's going to shorten your step length and most likely help decrease some of that loading force.
Yeah, it's gonna naturally take care of it, right? Because it's impossible to run at a higher cadence and naturally also want to run with more up and down force. So I could see how that might help.
Yeah.
What else you got?
What else do I have? So there's also, whenever you're analyzing running form, you really want to look at your pelvis, hips, and kind of that lower lumbar region as well. That's one of the first things I look at when I'm analyzing some form. And a lot of times when people are very lordotic and they have that kind of anterior pelvic tilt, they're doing a lot of compensatory mechanisms. So you want to look back. That can lead you to believe that maybe it's called overcasting, where they're extending their leg a little bit forward. And if you think in your head and imagine somebody bounding rather than running, you can see that they're kind of extending that leg way forward. And
That makes sense.
That's something like a telltale to kind of look at too.
Uh-huh.
The last thing is, a lot of running form drills. So I worked a lot with the University of Miami track team last year, and they do a solid 30 minutes of running drills and warm up before they even practice every day. So a lot of it is just making sure that a lot of the correct muscles are activated and ready to go so that you are performing in the correct way.
That makes sense too. That's all good stuff. Get things prepped, take down the up and down movement. That can really do a lot for someone that's running like that. All right, so
so I was just going to say, for the person who's going out for a quick run after work, after sitting all day, I'm not saying do a 30-minute drill session beforehand because you probably don't have time. But you want to make sure that you have some time, 5 to 10 minutes, to warm up a little bit, because if you just hit it cold, you might throw yourself off a little.
Yeah, definitely. And the thing you said about I think it was the increased cadence. Like, you don't want to go right up to that full cadence because it's the rule of twos again. You don't want to do too much too quick because your tissues aren't really used to having to deal with that so quickly. So that makes sense as well. So let's go on to the second cool thing you may or may not have planned for us.
Yeah. So the next thing is basically increased femoral internal rotation. But that being said, a lot of times you'll see, especially females, they run with knee valgus, where their knees kind of poke in. And so you want to look at why their knees are poking in. Is it because they're pronating from their feet, or is it because they have poor pelvic stability, core control, and their actual femur is rotating too much? When you land, your whole limb is going to pronate, which means your femur is going to have to internally rotate a little bit. However, if it rotates too much, you get your hips kind of rock side to side, and your knees drop into valgus, and you can pronate. So you need to step back and see, is it because of their, where is that coming from? But a lot of times it is coming from poor lateral hip control or transverse plane hip control. Most of us, especially if all we do is go out and run, or the majority of what we do is run, you're really used to running straight. You're not used to the side-to-side motion. So you lose a lot of that lateral strength and stability.
Okay, interesting. So what are some things that you would recommend for people to correct those issues?
So this one is, you can use a mirror so the person can watch themselves. That's good to incorporate in your treatment plan. I really, like I said, I like to step back and kind of see, where is this deficit coming from? Is it coming from their hip or foot? What weakness do they have? And then I'll do a lot of like posterior chain activation, lateral hip strengthening. Because a lot of times these people, you'll see they have like IT band syndrome or some sort of knee pain because they are collapsing in a little bit. So when you are correcting and you're doing the strengthening is great, activation is great, but you also have to make sure it's functional. So you want to make sure that you turn these static strengthening exercises into more of a dynamic component. So maybe doing some walking drills after you get that strength.
Yeah, you got to bridge the gap. That's a big thing with patients, like with my patients too. It's like making it functional isn't just targeting like the glute med, you have to actually work on those muscles and then make it functional. But you got to, once again, you got to work your way there, because if you just had them strengthen had them sideline doing an abduction with their leg, and then you said, okay, let's go running. It's not necessarily going to carry over. Probably a terrible carryover in that sense. So it's all about training. When they talk about functional training, like it's kind of overly used, but that would be a way to think about functional training is how can we make this rehab and these exercises relate more to the running that you're trying to do afterwards. So cool.
Exactly. Or like, a lot exactly what you're saying. You could do open chain hip abduction resisted all day. You could be sitting on their leg. But if they don't have closed chain dynamic hip abduction strength, it's not going to do them any good running.
Yeah, the closed chain portion, which is, when the leg's on the ground and it's actually carrying the other side of the pelvis up. So when you're running, that down leg, the closed chain one, because it's on the ground, is helping the other hip actually move correctly, as opposed to open chain, which is like the free open moving one, which you probably explained well, but I'm just saying it again, maybe just to sound smart.
I like it. It's a good explanation.
What else you got?
Okay.
What's number 3?
Number
for these
3
runners?
is a lot of people, especially females, again, are very quad dominant.
Yeah.
So basically, your glutes are just not kicking in as much. And that could be, again, for a lot of different reasons. But a lot of the time, actually, is you want to always check hip extension mobility. That's one of the early mobility assessments you want. Because if they can't get good hip extension, they're not going to be able to kick in their glutes really well when they push off. So they're going to be doing a lot of their work with their quads. And what you're going to see with this, it's not always the case, but if you see like a patellofemoral syndrome, or they're like, man, my quads are always cramping, or something like that, you kind of want to check in and see, hey, how's their hip extension? How's their glute activation? That kind of thing, because they might be really loading onto those quads, and their quads are having to really take the brunt of the force.
Yeah, like they're like secondarily inhibiting your glutes ability to control that back leg when you're pushing off of it. Is that what am I understanding that correctly? Like you're not able to extend your leg enough for your glute to actually kick in the way you want it to?
Yeah, that's one of the reasons for sure that your quads might be overworking. Another one is kind of what we talked about before, where like your center of mass is kind of posterior when you're running.
Yeah.
And you're almost bounding. And so when you overcast and your legs like very straight when you land, so you're landing on your heel. And so basically all that eccentric braking force is going through your gastroc and your quad. So
Okay.
That's another, going back to kind of one of the earlier faults that we talked about, how it all kind of ties in and why it's so important to tease out what exactly is going on.
And that's where it helps to get maybe a PT session, with Dr. Glick, because she can help you with this stuff too. And we can help you. You're the master. All right, cool. I like that. I like that that we're attacking it. So far we've seen some stuff to do with the way your bones move, your legs, the way that you're formed with running, and how that can affect your quad flexibility and your gait too. What other kind of cool things are common faults in runners?
So in PT school early on, you kind of learn about lower cross syndrome, and that's the kind of like sway back posture that you see. Like if you think of Shaggy from Scooby-Doo, where he's kind of like hanging on the front of his hips, his back's kind of curved. And, so basically what that says to somebody looking at them is that they have poor deep core control. Their glutes are pretty weak. And it even can go down to their foot intrinsics, honestly, because if, like we talked about before, when your leg lands, your whole leg kind of pronates in.
Yeah.
So that being said, your femur rotates internally, which means that you don't have that external rotation glute strength, which we talked about. But that also means that you drop into foot pronation as well. But if you think about it, some people who start at the foot think about that it starts with your foot pronation. So that means your intrinsic might be kind of weak. So I know that's kind of like going down the chain and everything.
Yeah, that's good. That's how we think though. You gotta look at the whole system. You don't know exactly what could be causing it.
Yeah, exactly. So that's why like a really great analysis of mobility and strength and control is a really important concept in terms of correcting your gait. So
What
a lot of
about just I want to show them what Shaggy look. So
did you find Shaggy?
that's
Yeah, but
Do you
look, do
see?
you have like a
It's a
side
bad
view there,
angle.
Jackie?
I know it's a bad angle. The only side view one I could find is him. I don't know if it's actually a fair. I don't. There's more questions than answers with this one.
Oh, it's
Let's see if we get
glowing.
that one. He's
I
dressed
don't
like a
think that's
girl.
what I was talking about there.
Actually, it looks like he has very strong glutes in this one. It's distracting. I don't know if
Why
this
don't you
distracts
just
from the point.
why don't you just look up lower cross syndrome and
I
show
think that
people?
it's better to just leave
Imagine.
the watchers with that. Yeah.
Okay. Well, so
Yes.
basically what winds up happening too is if your glutes aren't kicked on and you're arching your back, your lumbar extensors are going to be working really hard. So if you have a runner and they have low back pain, you want to check into this, see how their deep core is working, how their glutes are working. Are they over recruiting their lumbar extensors and not their deep core? I think Rob, you just posted something about that multifidus lift, the paper.
Yeah. It's a
So
good exercise.
yeah, that's something that for this person you might want to incorporate in their treatment, like a postural correction. And also make sure that when they like transfer their weight from their heel to their midfoot, they're able to have that core and glute control.
Yeah, definitely. I mean, it seems like something as simple as a lower quarter cross syndrome. It doesn't just look funny, but it can lead to a whole sequela of issues down the line. The hip and the knee, the foot. It can go from the foot up too. So, like you said, you gotta break that down. So I can definitely understand the concern with that. And a lot of people sitting all day at work, or standing, and they have a weak core. They don't really, maybe they're just weekend warriors. They're just starting running again. This might be a default positioning, which could be a precursor to some of these issues too.
You're
So
so right, because you're sitting on your glutes all day. So when you put that constant pressure on something, that muscle's inhibited. Also, you're sitting all day and your hip flexors shorten. So you're going to have inhibited glutes and tight hip flexors predisposing you for this kind of lower cross syndrome. So exactly what you're saying, like if you're sitting all day, you got to really pay attention and be mindful of this before you run.
yeah, definitely. I like it. I like it. So, so tell us a little bit about the next thing. Maybe it has to do with like your base of support or something?
Yeah. So
I just
you,
felt that.
yeah, the energy was coming to you.
Yeah, that's just the next logical step.
So, no pun intended. So, when you take a step, you want to see where your feet are landing. So, technically, it's wide or narrow base of support. You hardly
Hmm.
ever see somebody running with too wide of a base of support. They'll like waddle like a duck. You don't really see that too often. Um, what you see a lot of the time is narrow base of support. So where their foot's kind of landing and crossing midline or at midline. And what that does is you kind of like, if you can envision a model on a runway where their hips are kind of going up and down a lot. When we started this podcast today, we talked about the efficient runner and how important that is. Well, if you think about all of this up and down motion with your hips, it doesn't seem very efficient. And that also puts a lot of stress on tissues that don't need to be stressed like that. So there are, you know, a lot of it has to do with core and hip control, because you see patients like older patients, you diagnose them with what, the Trendelenburg gait where they don't have glute med strength.
Yeah.
And it's kind of like that. Like, if you don't have that lateral strength in your hip and you're crossing midline, it's a double whammy of having this like up and down movement with your pelvis instead of forward rotation.
Yeah, it looks that's another one that definitely looks funny. If you see someone running like that, it's not as obvious maybe as the earlier ones, but it's definitely something you can tell is like you can see like, man, that's a narrow little gate they got going. Maybe that's something that PTs notice more. I don't know. Maybe I'm judging a
It's
little too hard.
no, I mean, it's pretty common to be honest. It's not as exaggerated as a model's walk, but it still does. Like when you're running, it doesn't feel that funny, but when you're watching somebody, it does look a little bit funny.
Yeah, it's funny. It's funny how people develop these, how like just anyone can develop these funny little patterns. And people see it and it might look weird because we just have like that natural BS sense in our head. Um, but like, they just kind of live their whole life. They might run like that forever. They might be, you see some people that are master's age, and they have these running forms that look very inefficient, but like that's what they've done their whole life. And maybe they've skated by, maybe they have some chronic conditions because of it. And sometimes they might not have any issues somehow. So,
Mhm.
but to make things as efficient and look nice as possible, especially if you're getting into running and you want to stay with it, you don't want to get injured. because that's like the number one time people get injured. It's not like the middle of the career. It's usually at the beginning or the end, obviously. But that might also be like, you're looking for something as the last place you check because it's the last thing you checked. And if you get injured when you're done, then you're done. So these are my thoughts on that. But regardless, what are some things that you can do to correct a wide or narrow running gait?
Well, so when you're running, if you want to do it on your own or you want to tell your patient about it, a really great exercise is for them to find like a long, on the sidewalk, how there's like a long crack that you can
Mm-hmm.
follow. Or if there's like a line on the track, you want to land with one foot on either side of the line. So it's a really good visual cue for you. If you don't have the strength for that yet, though, like you're going to have to do a lot of that lateral and transverse plane hip stabilization stuff, where, like I said, you can start with regular activation strengthening, but you're going to also want it dynamic. So there's that really nice hip hike exercise you can do standing. And then what
Mm-hmm.
I actually, one of my, actually my research project, she had a lot of issues with this, which actually turned into medial tibial stress syndrome, which I think is like maybe the next fault. But so basically what I had her do is start with walking on either side of the line, and then I'd have her walk, hip hike, walk, hip hike, walk, hip hike, and we'd speed it up, speed it up, speed it up, and really do reps and reps and reps until she had
Yeah.
that lateral strength. So that's just an example of how to make it more functional once
Was she
you.
doing that on a treadmill or was she out on the track with you?
I I taped a line in the training room and she went back and forth, back and forth.
Whatever works. Yeah. That
Yeah.
makes sense. Sometimes you got to over accentuate the little things, and then once they get back to their normal gait, which could be a lazier version of it, it ends up just being normal. So you have to exaggerate. So there's the exercises that don't necessarily correlate immediately that strengthen the right muscles, like once again, like the glute med strengthening, just laying on the side, open chain, like we said earlier, where the leg is moving in free space, or even like a machine in the gym, just strengthening those muscles, which might have like the least carryover. And then once again, then you start making it more functional. Like you just said, you do an exercise that isn't running, but it's like pre-running, pre-gait. And then you're doing obnoxious steps, and then you make it faster and faster. And then eventually you're training the actual task, which is running. So that's
Mm-hmm.
the continuum. Strengthen isolation, strengthen as a unit, strengthen as more functional, and then full go with it. So that's how we think as PTs. So I think that the listeners might benefit from knowing that a little bit. It's just kind of the thought process. It's not just strengthening a certain muscle. Because you always hear people talk about like for example, in the gym, they'll be like, oh, my shoulder hurts. Like, oh, you just got to strengthen like the rotator cuff. And they'll be like,
Mm-hmm.
do this exercise. And like, so you'll see someone, okay, I'm going to do this. And then they keep doing that. Like, there's no logical next step. They didn't look into the whole problem. There's no making it functional, especially for running, because running's a repetitive task that can definitely become painful if you don't address some of these issues. So.
Yeah. Mm-hmm.
Cool. And then running on the line, that's a great one too, because if someone who runs, just me thinking about running on either side of the line sounds like stressful. I think I could probably do it, but it sounds like if you had a narrow base and you had to hit on each side of it, you might feel that you're waddling. But that's
Yeah, it feels
probably,
funny for
yeah,
sure.
because you're used to doing it in a way that's not ideal. So it's like when you tell
Yeah.
someone to fix their posture and they sit up straight, all of a sudden they feel like they're walking like a big jerk, but they're just walking normal. It feels weird to them. So I like this light because it can show my hair from the side, my little lift right here. You see that?
Yeah,
That's,
I do.
yeah, and then you can even see the back of it. You can check to see if I can make sure that's looking good. So
Bald spot.
no, it's
I'm just teasing you.
been taken care of. I'm that's
You
why I
don't
work.
have one yet.
I bought the special hair thinning shampoo. Actually, I noticed using less shampoo, which sounds disgusting because it is better, because you just use the fingers through the hair and it doesn't stress it so much. And then you can use shampoo again, but you just got to take a break and constantly shampooing it, because that'll
Yeah.
dry it out.
Well, and who
So
cares if you smell good these days? Because we're all behind a computer anyway.
yeah, that's true. Yeah, that's my patients
There
can't
you
smell me through the computer. It's when they can start seeing you smell, that's when it's bad. That's when you've gone too far.
go.
And
Like
they
green smoke coming in.
yeah, like the cartoon, like Shaggy.
back to Scooby-Doo.
Yeah. All roads lead back to Scooby-Doo. Tell us
Okay,
about
the next
medial.
one.
Yeah, tell us about shin splints.
You're really reading the force today.
Mhm.
Um, so shin splints or medial tibial stress syndrome, there's kind of like a whole path of that. So a lot of people will have pain along like their medial tibial region, hence the name.
Mhm.
And so depending on how far along they are when they get to you, or when you are noticing this, because a lot of runners tend to just run through pain for a long time.
Yeah.
Um, you know, it starts with kind of a stress reaction along that medial tibial, and it can progress all the way to a stress fracture. So you really want to catch it early. But again, you have to see where it's coming from. Is it coming from their lack of intrinsic foot strength and they're dropping into pronation and putting a lot of stress on that medial tibial region? Is it because they don't have that core stability? They're dropping into internal rotation of their femur, knee valgus, and then putting more strain on that medial tibial region and then pronating their foot. So you kind of have to tease out what's going on there. That narrow base of support can lead to this. Internal femoral rotation can lead to it. So it's kind of a symptom of some of the other greater things that we've already talked about.
Yeah, that makes sense. It's more of a down. It's down the line a little bit of it, maybe. One thing can lead to that. So that could be the canary in the coal mine. That could kind of get you alerted to what might be going on.
Yeah.
All right, cool. So are there any kind of considerations in terms of like footwear or anything like that that people could think about when they're trying to help this situation out themselves? Because that's
Yeah.
always a big one. People talking about shoe. You gotta get this shoe. It stops you from pronating. Get this shoe. You're overpronated. And then you got people at the Nike store explaining to people that are just starting to run that they have some severe foot condition and that they need to get this shoe. When in reality, they don't know what they're talking about, most likely. So what kind of footwear concepts would help with something like this?
Well, it depends on the person. So,
Mhm.
if you go to a Nike store, they're going to try to sell you a Nike shoe. So you got to make sure that you go to a store where they're really going to evaluate some of the running stores are pretty cool. They got the force plates and everything.
Oh yeah.
But
In Miami, is there one?
I couldn't tell you off the top of my head. I think there is one in Coral Gables. What is it
Yeah, I think
called?
I knew one in Doral, but I forgot the name of it too. Oh, the word
No,
run is in it.
yeah. I can't believe I can't remember right now.
The
They're
one right
pretty
on
good.
Bayside. It used to be on Bayside by the water.
I don't know. It's downtown
They're gonna
closer.
be so mad. They're one of our biggest sponsors on this show. They pay $100,000 an episode for me to do this.
Wow.
Yeah, and
Impressive.
I forgot the name of them. But yeah, those the
Anyway.
stores with the force. What?
Anyway.
No big deal.
No,
That's why I'm in this
I don't
casual
think there's like
stance.
I don't think there's like any particular shoe that's good for you. You need to make sure that you find the right one for you. I think that, there's all these fads that people go through.
Hmm.
Um, don't get caught up in the fads. I would say this is another kind of part where you might want somebody to help you out choosing a shoe if you're having some pain. But you're right. The whole rule of two is you want to look at too much, too fast, too soon, but you also got to look at your footwear and what you're running on. So if you're running, all of a sudden you're going out and running 15 miles on the cement, that's a lot. So
Yeah.
like personally, what I like to try to do when I'm training is I'll try to mix it up where I'll do like a run on the sand, get some good resistance, or I'll run on the track. I try to change up my running surface so that I'm not completely just pounding on cement for like 40, 50 miles a week. It's a lot for your body to handle, even if you're efficient.
Yeah.
So that's something to think about. You know,
Variation.
exactly. So that's one of the things, footwear and your surface that you're pounding on.
Yeah, especially because you think of people who might run on one side of the road, like if they're like in a country town or something,
Mhm.
and um, the road is curved towards that side. They're always running on the right side of the road. They might run on the right and run on the right coming back. So you constantly have one leg that's elevated and one that's lower than that. So I'm sure that can create
Yeah.
problems as well.
That's a really
Um,
that's a great point. And that being said, also if you're a track runner and you're always
mhm.
running the same way around the track, it's like the same concept. One outside of your leg gets stressed more than the than the other, and an inch.
Oh, because the turns, yeah. You're
Yeah.
constantly turning left. It's not like a car. It's not like NASCAR. We're not built like that. Yeah,
Exactly.
anything repetitive and the same is bad. So people have their routes they always plan out. They run the same route every day for, like 3 miles a day. So, it sounds all nice and well, but it might be nice to check out some new stuff and not constantly run the same way and the same spots with the same like the same floor, like ground resistance. It sounds like it might be helpful to maybe try some other stuff out. Run in the water, run through the dirt, maybe go in the basement of your building and, run through the sludge, figure it out, give
Yeah.
yourself some variation. The garbage hill that I mentioned earlier, the trash heap, whatever works.
Dumpster diving.
Yeah, go dumpster diving. Look for those needles that were thrown out. You could sell those for good money. Whatever you got to do to change it up. Just change it up. Especially if you think of a treadmill, people might run on a treadmill all the time. That's another example. I mean, that's the same resistance. That's the same exact. I mean, no matter what treadmill you're using, it's going to feel essentially the same. So, what do you think about, for example, the difference between a regular treadmill and the self-powered ones? Do you have any opinions on that? The ones that are a little bit curved, that are self-powered, that you can pull under you?
Well, I've tried it out myself. I don't have any like objective research to tell you. I think
Yeah.
that for me, it made me like overreach a little. I was not doing well on it. I think I need to practice on it. I don't really have anything great to tell you
Yeah, if you're
about.
used to one type of treadmill, you go to that one. Yeah.
Yeah.
Um,
So, but that's a great point that you brought up, that like if you're used to training on like, so for example, what I run into problems with sometimes in clinic is like my patient comes in during an eval, and a lot of people, you forget, like if they're saying, okay, well, my knee hurts after so many minutes of running. A
uh-huh.
lot of people will just like go into their assessment, mobility, and strength. I like to get them on the treadmill and have them run and get into a nice groove and, see where their running fault might be, because that's what is their exacerbating factor. But sometimes you get somebody on there it's never run on a treadmill, and that completely is like throwing them off. So like for me, if you were going to analyze my gait and put me on one of those self-propelling treadmills, that would not be my real running gait, you know? So that's something else, if you're a PT listening to this, it's something else to consider as well.
Yeah, the most natural way to test the running gait sounds like get outdoors with them, take a video, figure that out. But yeah, sometimes you got to work with what you got in a clinic, and you get the treadmill going and the mirror, of course. But yeah, taking videos and have the patient self-assess is great too, right? You start teaching them what's going on. Do you see this? Do you see this? Oh yeah, I can see that. They start getting a picture of maybe where their faults are, and that intrinsic knowledge, as opposed to extrinsic knowledge, which doesn't make any sense.
No, you're
They
right.
under
Intrinsic
they
motivation versus
understand
extrinsic. Yeah.
extrinsic motivation to fix, yeah. But I said extrinsic knowledge, regardless. That 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 knowing about their own body, that body awareness, can leaps and bounds. It can do a lot for them. So definitely can learn a lot just by talking it over, with someone who knows what they're doing. Maybe a physio,
Mm-hmm.
maybe Dr. Glick, maybe Dr. Rob.
That's another thing I use, like for my patients that come in. I use a running app, and what I like to do is get a posterior view and a lateral view, and then
Mm-hmm.
I have different lines. We can go through it another time, but I have different lines that you draw through and kind of measure their angles,
Like,
and
yeah.
then I always show them. And actually, you can add them onto the app that I have. I forgot what it's called though right now, to be honest.
What's
Um,
the app called? Oh, I'm interested.
I'm gonna have to look it up. I don't remember right now.
There's one for weightlifting that kind of does that.
Yeah,
And it is called, oh man, here I am. I thought I was going to be able to rip off the name. Just get it right now.
we're both having word finding issues tonight, huh?
Yeah, that might be another episode, the development of brain degeneration in the physical therapist. Yeah, I forgot the name of the app too, but yeah, it's the kind that just like puts vectors, right? I mean, the one that I'm thinking of is more for
Yeah.
yeah.
Well,
Um,
you can choose where to put the vectors. It's really cool. You can play with the angles, but regardless, there are like a million apps that do that.
yeah.
But, so, you just have to pick one, and then you can share it with your patient. You can show them, but analyzing and looking at angles instead of just like kind of eyeballing it is really nice to do sometimes. Because then you can get like objective measures throughout the course of treatment. The one thing I will say is though, if you don't want to like perseverate on certain movement patterns, because you don't want a patient to go out run and every step they're thinking of like,
Yeah.
I got to do this, got to do that. So just be careful with that when you're trying to treat somebody.
Yeah, that could be a slippery slope, focus on this and that. And they're gonna do rule twos, they're gonna go too much. They're gonna try to do it perfectly from day one, and they're gonna totally go for too much, and it's gonna be a whole new movement pattern, and it's not gonna end well. So it's step by step. If you make like a 10% difference every couple weeks, that's great,
Mm-hmm.
There's experienced runners that have weird form. So we're just trying to make improvements to protect yourself. That's why we're here for you guys. So what else you got for us? I think there's like one
So I
more.
think the last one is Achilles issues or gastroc issues. Most of the time, Achilles, like a tendinopathy, is more of a pace injury where, so your Achilles, it's designed to take a lot of eccentric load and concentrically propel. So
Yeah.
when you have a sprinter, sprinters naturally don't really have that eccentric phase. They're able, because they're going for a short period of time, they don't have to load to explode. They're just exploding the whole time. So it's concentric, concentric, concentric. But if you have somebody that's just starting out, just starting to go faster or running pretty far, and they're really skipping that eccentric loading phase, most likely they're going to have some sort of like Achilles or gastroc issue. So that's something to kind of look at with this.
Yes. Yeah, definitely. I mean, the stretch shortening cycle, right? That's what it's
Mm-hmm.
all about. It's just like the eccentric part of something for the people who are listening and can't see our really good hand motions is when the joint, like the muscles in the joint are lengthening. So a lot of the times, especially when you're running and those things are lengthening, the tissues that are controlling that. So in this case, the Achilles tendon and the calf muscles are going to need to be able to stretch and then return it really quick.
Mm-hmm.
And I'm sure I think a lot of people have had Achilles tendinopathy at some point in their life, no matter what they're doing. If they're active and they're starting CrossFit, running, anything like that, at some point in your life, you probably ran across this where like the back of your ankle, maybe on both sides at once, are just they really are sore. And you don't want to run, and like a calf raise and going all the way down is scary. And the down part is the eccentric part. So just for
And then
people
for you
listening.
put like a lot of force through that tendon. So it makes sense why that would be the scary part.
Yeah, it sounds like that would be the last thing you want if it was really sore and it didn't want to take any load from the running. So what are some things um that you could do maybe to help with this condition? If you feel like you have Achilles tendinopathy, whether you've gotten diagnosed or you feel like you have it and you want to try some stuff to work on that.
Yeah, so you kind of want to see how their foot's landing. Sometimes it's just as simple as taking back their training a little bit and making sure that they have that strength in that Achilles before they're really loading it so much. So
Mm-hmm.
you want to go back and look at maybe how their foot is positioned on the ground. So you go back and look at their calcaneus position, look
The
where their
heel.
toes, their mat head, yeah.
Yeah.
Kind of just see the position. So there's a lot of good like foot strengthening um, like protocols you can follow. There's one clinic up in the Northeast. She's like, she totally just believes in barefoot running. Anybody that comes into her clinic will do like 8 weeks of foot intrinsic strengthening, and she has actually really good success. So that being said, I'm not saying people should barefoot run. I'm saying there's like some really good foot intrinsic strengthening exercise that you can do to build up that strength.
Yeah.
Or like a great exercise to do is a simple walling where you're like facing the wall close by and you just kind of let yourself fall forward. So your Achilles is lengthening into that eccentric load, and then you catch yourself obviously with your hands on the wall. Um,
Like Michael Jackson.
yeah, exactly. But he didn't need to catch himself.
Yeah, he
Yeah,
had
you
very
did.
strong calf. Yeah, very strong. Um, the just real quick before we move on from the first part of that first thing, the
Yeah.
girl who works with in the Northeast, how do you know about her? Do you follow her on Instagram? Because I think I know.
It's not a girl. It's like this. So there's the guy who I mentioned before, who's based out of Wisconsin. He's Heiderscheit. He's all about
Heider Scheit.
yeah, Heiderscheit. I love that that his name is. But
Heiderscheid.
he's done so much research. He's brilliant with running, but he really
Okay.
looks at cadence, changing cadence. A lot of his research has to do with that. This woman, my brain's not remembering her name right now, but she's like super into barefoot running. She's there's
Interesting.
like 3 huge gurus in the running community, and they've done a ton of research. So she's one of them.
Yeah, it sounds like if you
She,
do it, yeah.
yeah. Well, she's more into like, I was saying how some people look at your pelvic stability, some people look at your foot, and some people believe it comes from higher, lower, whatever. She's more focused on like your foot.
Okay, yeah, she's starting at the base right there.
Mm-hmm.
I mean, it sounds like you can't go wrong if you've done your research and you're a physical therapist and you're working on people barefoot, and you're doing it in a correct pattern where you're not pushing them too quick, too fast.
Mm-hmm.
Um, it sounds like you couldn't really go too wrong because you're working with what they got naturally and you're focusing on the foot, which is a very dynamic part of the body. So you want to be able to, instead of putting them in a shoe, you actually get to see what's going on. So I could see how that would be an effective way to do it. But I think that a lot of the times people think, okay, they're going to get like Vibrams or toe shoes and they're just going to go running like 6 miles like they did yesterday. And that might lead to an acute injury. So, but it might not, but it's just something to think about is like, once again, you want to, and I've read a study on this before too, like with the toe shoes, they even have protocols out there like they do for everything that you can find that have been studied that you can wear them for certain distances over the course of weeks. So eventually by the end of it, you can avoid the rule of twos or utilize or think about the rule of twos and not do too much too quick. And you can actually grow into the distances that you want to hit without doing too much at once and screwing yourself up.
Yeah,
So definitely
I
something to think about.
agree with that for sure.
Anything else related to Achilles tendinopathy and ways to fix it that you have for us?
Um, the last thing I'll say is, a lot of people are landing with a rigid foot when they're up on their toes or have an Achilles pathology. So if you try to cue them and say relaxed ankles, again, it's
Mm-hmm.
kind of like saying land softer when you're having somebody with too much of a vertical oscillation. So it's not going to solve the problem, but it's going to add in your rehab program.
Cool. Yeah, that makes sense. So, are they running hard like that, like naturally, or is that as a result of avoiding the pain that they have anyway? So is it chicken or the egg in that case?
That's a good question. Typically, I would say that if it's probably that the way they're running is causing that pain.
Okay, that
I
makes
would say.
sense. Yeah.
Um, yeah, because especially with Achilles tendinopathy, you don't really see too many people really trying to run on their toes with an Achilles tendinopathy.
Yeah, that would be fun.
No, a lot of times you actually see them kind of like limp with a flat foot.
Yeah, which is probably how I look running regardless. That's just my natural form. Um, well, that's awesome. I mean, that was a good amount of info. And I think that people listening from all different perspectives will understand that there is a lot that goes into avoiding injury, especially with running. Whether it's sprinting, jogging, anything you get into, running is more dynamic than people think. It's not just something that you're just going to be fine. Just go every day. You'll be fine. Sometimes people run into these issues and you have to address them. So this is this is not an exhaustive list. And like you were saying before the show, when we were talking in the green room, we were discussing how like, just because you think you have some of these things doesn't mean you do. So just be aware of those things and just be happy that you learned some stuff today, listeners and watchers, because it's really just a set of guidelines for if these things come up, and it's not necessarily saying that you have them, and sometimes you might not and you think you do. So honestly, the best thing you can do is at least get an evaluation with a physical therapist, give some exercises and continue with them, or utilize some of the stuff you learned today with a combination of that. But just know that like with running, it's a dynamic task and you got to be careful sometimes, especially when you're feeling like an injury is coming on. Do you have anything else that, if you had any golden nuggets for the listeners or watchers today, what would you say? It's a young Sarah Glick. She's 18. She's entered the Olympics. No. she went to the Olympics and she liked what she saw. She's starting to run. She's 28 now. She didn't go to PT school. It's not you. Okay. It's someone with a, and they are starting their running career, and they go like, what's something that you'd be like, okay, just watch out for these things, or like, here's what you should do. Here's my words of wisdom.
Words of wisdom. Okay, that's a loaded question. Um,
Just general stuff, take
I
home
would
points.
say that a lot of people think that they're gonna go out and they're gonna run to get fit. But I think that a lot of times you have to be fit to run. So especially if you're going to really want to jump into a training program, don't just say, okay, well, because a lot of runners get really addicted to running too. You just go out and you like hammer the miles. And then you get people with runner's logic where, okay, well, I ran this far today, it didn't hurt. I ran this far the next day, it hurt, but I'm gonna run this far again, it won't hurt. So you get into these like psychological patterns if you're out there. So what I would say is that make sure that you check in with some of that cross training, strengthening. It's really worth going and getting a running evaluation just to make sure that you're set up for success. Because the last thing you want is to get hooked on this wonderful sport of running and then have an injury and have to backtrack, because that just drives somebody nuts. So just make sure you're being smart about it. Anything that seems a little bit too good to be true, maybe be a little bit skeptical, and then just
like what?
sure,
Like if it's
too
good to be true.
Any of the fad things that are coming out.
Oh, yeah. Yeah.
But, really like just make sure that when you're going out, you're like doing the best you can to enjoy it, because it's such a beautiful sport.
It is. It's a sport where, you can stop and smell the roses if you need to. There's no opponent trying to stop you, which might be an interesting spin-off of running you could invent, where like you're trying to run and then there's someone defending you from getting to the end. Imagine that in the Olympics. You got to stay within the track, and there's like one guy and another guy, and he's just got to run 400 meters, and they start facing away, so they meet in the middle. Or there's different strategies. You could wait right by the finish line. You could just save your energy.
Yeah.
So yeah, just interesting stuff. But that's another
part of the Olympics. I like it.
Defense running. And like, yeah, the later rounds, the lane gets smaller. So eventually it's just like you're basically in a hallway. You're in a hallway. I mean, you could just
a spike suit.
Oh my God. Like how spiky?
I don't know.
Could it kill them?
Depends. Are we in Hunger Games now?
Oh God. Just give them a sword and they could poke each other in the chest. And then they can stand.
Fencing.
All right. So so we did it. We should get some credit for it then. I don't know. But thank you for coming on. I mean, this was good and formal, but also informal in a good way. So, and there's so much more. I can feel that there's much more to this. If there was some kind of PowerPoint situation, I bet it would be more. And it's interesting because there's so many levels to this, and it's like you can just learn this basic. And this is basic stuff, even though it's not basic. It's hard, but it's like basic to learn because it's level 1 stuff. So then you start getting into theory and protocols like we were talking about, and how to carefully build yourself up and down from here. So a lot of stuff to learn, people. So I mean, there could be more episodes about this, just this. There could be a whole nother episode on just this Olympic sport we discussed, fencing, that we invented, and you don't know. The possibilities are endless. So just keep in there, everyone. Do you have any final words? I guess you just kind of did give your final words, but
yeah. Well, thank you for having me. It's been fun talking about it.
Yeah. And how can people? So if someone really wants to know something about you, what's the way that you'd want them to reach out? Like maybe not you, but people. You work at a certain clinic around here. I don't know if you want to talk about that, but you know a lot about running. I think that'd be a disservice for people to know how to work with like someone who's been through a sports residency, and it's so smart. They really want to know something from you. Is there any resource you have for them, whether it's you or a book or a person?
That's a good question.
I know that's a tough one.
I mean,
but you have to answer it because I'm waiting.
Yeah, I know you're waiting. It's in the little record button is going like this.
Give
Um,
me something.
well, there are a million resources. That's the thing. It's like never ending research. I mean, running's been around for forever for various reasons. Right now, most people
Yeah.
run for fun, but I guess if people want more info or want to get in touch, they can get in touch with you, and then we can always connect
Then
that
I'll
way.
hook it up. All right.
Yeah, how's that?
All right. Yeah.
That's
See, we
the
went over this
easy way out
beforehand.
for you.
Yeah, I made her. Is there any running movies that are inspirational to you? That's
Forrest Gump.
like, oh my God. I guess that is a running movie, huh?
It is. His feeling of never wanting to stop running is like exactly how I feel when I
That's
start running.
true. That's such a good, some people would say something like a stupid movie that's really technical about running.
No, I
But the
don't
fact
know
that you said
those.
Forrest Gump. Yeah. I
I
don't know
just
if that, does that exist? Are there any entertaining movies about training for running
yeah,
besides
I mean,
Forrest
there's
Gump?
like the stories about Prefontaine. Like that's a great
True.
movie.
He's like that
Um,
famous hippie.
he's from Oregon. I don't know if that's like what you're trying to
It's
say.
Oregon.
I knew you were gonna correct me on that. That's a
It's
great
because
movie though.
Chaz.
I don't know. I
Yeah.
haven't seen a lot of these movies in years, so you know me
I'm
with
sure
movies.
Netflix has some crap that's like artistic and interesting.
Yeah, like
So
just maybe search Run.
yeah, and there's probably a bunch of things about running. That's how that works. Or it could be running away from criminal, who knows? So check that out. Any
Yeah,
questions, you
stories
can just
like
direct them to me
yeah.
because I am the almighty gatekeeper to Sarah's
Ah,
brain power in this particular situation. So once again, it's HealthCast305. You can follow me on Instagram at HealthCast305. And my other Instagram where I spend more of my time is Dr. Rob Polizuk. So that's a lot, but it's DR because Dr. ROBPOLISZUK. So you can Instagram that, check that out. You can also go to my website, drrobpolizuk.com,
what about physiologic?
bricklephysicaltherapy.com. Well, I'm wearing the shirt. This is my
Yeah.
PT clinic. But I don't always try to push it
Oh,
every episode. I don't want to shove it down their throats. I just
well,
want
I
them
did for you.
to. You did, and this is the second episode in a row this has happened, and it's starting to look like a conspiracy. Like I'm telling my members, my guests to do this, and this is just.
Oh,
I would never do. I'm a man of great honor.
maybe you
I
shouldn't wear the
would
shirt.
never do that. With the light just shining on it like that. I
Disclaimer,
didn't
you
want to
did
bring
not
this
tell
up.
me anything about this earlier.
Save me. Help me. This episode's going to be perfectly 1 hour. I'm really happy about that. We might have to include some of the stuff beforehand of me clapping.
No, please don't. I have no idea what was going on.
Very confused. That's how we like it. All right. Well, thank you very much for coming on. You didn't need to do this. No one needs to do this, but people have wanted to, and I guess it's because
Because we
you're a
support you
smart
because
person
you're a
and a good
smart
friend.
PT.
Thank you, smart PT. You too. Okay, so please reach out, people listening, and thanks for listening in today on HealthCast 305, episode 2. Dr. Sarah Glick. Thank you very much, and goodbye.